This conversation just really speaks to how much more complicated your lives are than for the previous generation.
Health and Human Services Deputy Secretary Andrea started the discussion at Bernardo Heights Middle School by recognizing that students today face more challenges than the previous generation, from bullying to suicide to school shootings.
Am I going to protect myself? Like, what if I'm with my family? What if I'm with my friends? Like, that kind of thinking was because of like the active shooter drills that I've been doing since I was in kindergarten at my school.
I think we're all a lot of us are numb to it. Especially
I remember when our school had a shooting threat and we had to go into a lockdown. It was a big deal and a lot of kids were scared.
And that takes a toll on their mental health.
I think kids are really feeling the weight of the world more than they did in the past.
Dr. Ben Maxwell is a child psychiatrist at Rady Children's Hospital. He says students are more digitally connected, and that's not necessarily a good thing.
The more we can find ways to help kids manage those stressors and manage the information that's coming in through their phones or through their screens or through computers, just this connected world we live in, I think the better we can support them.
And that's where the Suicide Training and Awareness Nationally Delivered for Universal Prevention Act, or Stand Up Act, introduced by Congressman Scott Peters, comes in. Congressman Scott Peters was inspired by what the students here told him in 2019 about mental health and gun violence in schools, and that became the basis for the Stand Up Act, which became law last year. The law prioritizes funding for awareness and prevention of school gun violence and suicide. Peter says middle school students are the target audience for these policies, and it's important to hear what they have to say.
They came up with some pretty good ideas, among them media literacy, so we understand social media better, support for parents, not just for students, or not just for teachers and administrators, and also continued funding for mental health programs in schools. That's the kind of feedback we need.
Sam Boyce was there in 2019 for the roundtable with Peters. He says it was incredible to see legislation put in place for what they raised concerns about.
Especially with the suicide rates going up and just the overall stigma around mental health in middle school and high school. I've seen it firsthand. I've had my own mental health struggles, and I feel that it's just such an important thing that people need to talk about.
According to Rady Children's Hospital, pediatric psychiatric crisis has increased nearly 28 times from 10 years ago, and it's showing no signs of slowing down. Alexander Nguyen, KPBS News.